In this presentation, I will be talking about value of intra-abdominal normal saline infusion in reducing the need for opioid analgesics for postoperative pain control. Here, the authors, Dr. Duncan, Dr. Lipalau, and myself, Dr. Ulualp, have no conflicts of interest or financial ties to disclose. Results of the efforts in limiting the use of opioids for postoperative analgesia after a bariatric procedure hasn't been optimum. Almost all patients receive opioids, which may be a patient's first exposure to opioids. Higher risk of opioid-induced hypoventilation, respiratory complications, and higher prevalence of obstructive sleep apnea in morbidly obese patients make opioid analgesics a less reliable alternative in the management of postoperative pain. Since one of the major reasons for postoperative pain is carbon dioxide instillation, this study was performed to assess the effectiveness of a novel approach of instillation of intra-abdominal normal saline to potentially neutralize the effect of retained carbon dioxide and to assess its subsequent effect on postoperative pain. The goal of this study was to identify a correlation of neutralization of carbon dioxide-induced pain and that of opioid consumption following laparoscopic bariatric surgery. We studied 100 consecutive patients undergoing laparoscopic sleeve gastrectomy due to morbid obesity. The patients were studied in 2 equal study and control groups of 50 each. The groups were matched on age, BMI, gender, and comorbidity. The study group received 2 to 3 liters of intra-abdominal normal saline infusion at 37 degrees Celsius at the end of the operation, while the controls did not. The protocol included pre-incision local anesthesia with long-acting bupivacaine. All patients underwent standard anesthesia protocol and were given 4 consecutive doses of non-opioid analgesics postoperatively. The visual analog pain scale and total opioid analgesic consumption was reviewed. Outcome measures were postoperative pain, opioid use, and length of stay. A p-value of less than 0.05 was considered significant. The pain score, as in mean plus and minus standard deviation at postoperative 12 hours in the study group was 44% lower than the control group, which was statistically significant as seen in figure 1. The number of patients requiring breakthrough opioid use was significantly lower in the study group, which were 6% versus 72% as seen in figure 2. In conclusion, we believe instillation of saline facilitates carbonic acid formation by hydration reaction of carbon dioxide, which is then further catalyzed with carbonic anhydrase in the peritoneal membrane, resulting in the production of bicarbonate dissolved in the blood. This catalyzed reaction is reversed in the lungs, where it converts the bicarbonate back into carbon dioxide and allows it to be expelled by respiration. Our results have demonstrated that the reduction in pain, as depicted in Figure 1, as evident by multiple parameters as depicted in Figure 2, was prompt and continuous at 48 hours. Intraabdominal instillation of normal saline has the potential to diminish opioid use for postoperative analgesia following bariatric surgery. Further studies are needed to realize the potential for this technique in reducing opioid usage following bariatric surgery. Thank you very much.